Imagine AI influencing whether your healthcare plan gets approved or not. Well, that's exactly what started earlier this year in 6 states, including Ohio, through a new Medicare program called WISeR. And it's one of the reasons Medicare is actually now being sued. So, the goal of the program was to reduce fraud, unnecessary procedures, and healthcare spending by using AI assisted reviews before certain treatments, imaging, or surgeries got approved. And in theory, it sounded reasonable. But one of the biggest concerns is the financial incentive structure behind the program. So, according to Medicare's own documents, the companies involved can receive part of the money saved when less gets spent on care.
Huh?
Basically, you're telling me if healthcare spending goes down, those companies can financially benefit? And that's where people should start worrying about conflict of interest. Because when companies financially benefit from reducing spending, it should raise understandable concerns about whether or not this could lead to more scrutiny, more paperwork, longer delays, and more barriers before patients finally get approved for medically necessary care. So Medicare does say physicians can still make final decisions, but the concern should be AI systems can still heavily influence delays, denials, and repeated reviews before meaningful physician evaluation ever happens. And medicine is full of nuance, right? Context, timing, severity, clinical judgment matters. So this lawsuit is asking for transparency about how these systems are being used, and more importantly, whether patients are actually being harmed by delays in their care. Because one of the biggest concerns in medicine right now is the shift that healthcare is slowly becoming more focused on administrative efficiency and cost savings rather than the actual human being sitting in front of me asking for help during their patient appointment.